Hi guys. Today we will learn about hand washing or hand hygiene. Imagine you saw something disgusting on your hands, such as blood or any body fluid. You would not hesitate for even a second. You would be at the sink scrubbing away the yuckiness. It's gross and could be dangerous. Of course, you would want to wash it off immediately. But many dangerous germs are invisible to the eye and can be found everywhere in healthcare facilities. Regular hand washing in healthcare by medical staff is a key element to reducing the risk of infection. So today we will know about hand washing. Hand washing, also known as hand hygiene, is the act of cleaning hands for the purpose of removing soil, dirt, grease, and microorganisms. Keeping hands clean is one of the most important steps we can take to avoid getting sick and spreading germs to others. This helps prevent infections because people frequently touch their eye, nose, and mouth without even realizing it. Now, why is hand washing important? Keeping hands clean with improved hand hygiene is one of the most important ways to prevent sickness and spreading germs to others. Good hand washing can fight the spread of common cold, meningitis, bronchitis, influenza, hepatitis A, and most types of infectious diarrhea. Now, why is hand washing important for healthcare providers? Practicing hand hygiene is a simple yet effective way to prevent infections. Cleaning your hands can prevent the spread of germs, including those that are resistant to antibiotics and are becoming difficult, if not impossible, to treat. Dirty hands are a contributing factor in the spread of healthcare associated infections that affect 1 in 25 hospital patients on any given day. Hand hygiene by healthcare professionals is seen as the most important strategy to prevent patient to patient transmission of healthcare associated infection in any healthcare setting. All healthcare professionals know the importance of hand hygiene to prevent spread of infections, but also recognize that they sometimes forget to wash their hands in an often rushed and busy clinical environment. You can either use soap or water or alcohol-based hand sanitizers. Now let us see the steps of hand washing. Wet hands with water. Apply enough soap to cover all hand surfaces. Rub hands palm to palm. Right palm over the left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Then back of fingers to opposite palms with fingers interlocked. Then rotational rubbing of left thumb clasped in right palm and vice versa. Rotational rubbing backward and forward with clasped fingers of right hands in left palm and vice versa. Rinse hands with water. Dry thoroughly with a single-use towel, or you can also air dry. Then use towel to turn off the faucet, or you can also use your elbow if it is an elbow operated tap. Now your hands are safe. Now let us know the 5 moments of hand hygiene in healthcare setting. Before touching a patient, after touching a patient, before clean or aseptic procedures, after body fluid exposure risk, after touching patient surroundings. Thank you.